Question 1. A patient is admitted with pneumonia due to the influenza virus. Which code should be sequenced first? A. J11.08, influenza, not identified, with other specified respiratory manifestations. B. J10.08, influenza due to other identified influenza virus with other specified respiratory manifestations. C. J11.00, influenza, not identified, without pneumonia. D. J10.00, influenza due to other identified influenza virus without pneumonia. Answer: A. J11.08, influenza, not identified, with other specified respiratory manifestations. This question tests the sequencing rule for influenza with pneumonia. The primary diagnosis should be the influenza code, followed by the code for the pneumonia. The keywords pneumonia due to the influenza virus indicate a direct causal relationship, making influenza the principal diagnosis. If the specific type of influenza virus is not identified, the code from category J11 is used, and J11.08 specifically includes the manifestation of other specified respiratory manifestations, which would encompass pneumonia. Remember, when a condition is stated as being due to another condition, the code for the underlying condition, like influenza, is typically sequenced first. Question 2. A patient presents with pain in the left knee. The provider documents osteoarthritis of the left knee. How should this be coded? A. M25.562. B. M17.12. C. M17.10. D. M25.56. Answer: B. M17.12. This question requires locating the correct code for osteoarthritis of a specific joint. The diagnosis is osteoarthritis of the left knee, which guides you to the M17 category for osteoarthritis of the knee. Looking at the subcategories, M17.1 specifies unilateral primary osteoarthritis, and the fourth character indicates laterality. M17.12 is the correct code for unilateral primary osteoarthritis of the left knee. Pay close attention to laterality in musculoskeletal codes, as specific codes exist for left, right, and bilateral involvement. Question 3. A patient fell from a ladder at work. The patient sustained a fractured wrist. What is the appropriate ICD 10 cm code category to describe the circumstance of the injury? A. V00V99 transport accidents. B. W00X59 other external causes of accidental injury. C. Y00Y99 external causes of morbidity, not elsewhere classified. D. Z00Z99 factors influencing health status and contact with health services. Answer: B. W00X59 other external causes of accidental injury. This question focuses on identifying the correct external cause code category for an accidental fall. The circumstance is a fall from a ladder, which is considered an accidental injury not related to transport. Looking at the external cause code chapters, W00X59 covers other external causes of accidental injury, including falls, W00W19. These codes provide valuable data on how injuries occur and are important for injury prevention efforts. Remember to assign an external cause code whenever documenting an injury, poisoning, or adverse effect. Question 4. A patient is diagnosed with type 2 diabetes mellitus with diabetic nephropathy and diabetic retinopathy. Which condition should be sequenced as the principal diagnosis? A. Diabetic nephropathy. B. Type 2 diabetes mellitus. C. Diabetic retinopathy. D. It depends on the provider documentation order. Answer: B. Type 2 diabetes mellitus. This question tests the coding guideline for conditions that are manifestations of diabetes mellitus. When a patient has diabetes with manifestations, like nephropathy or retinopathy, the diabetes code is always sequenced first, followed by codes for the specific manifestations. The keyword here is with, indicating the nephropathy and retinopathy are direct results of the diabetes. Type 2 diabetes mellitus, E11, would be the principal diagnosis, followed by codes for the nephropathy and retinopathy. Always code the underlying condition, diabetes, first when its complications are listed. Question 5. A patient is admitted with acute appendicitis with perforation. Which code reflects the perforation? A. K35.2. B. K35.3. C. K35.80. D. K35.89. Answer, B. K35.3. This question requires identifying the correct code for acute appendicitis with a specific complication, perforation. The diagnostic statement includes acute appendicitis with perforation, which is a key phrase to look for in the ICD 10-cm index and tabular list. K35 is the category for acute appendicitis. Looking at the options, K35.3 is specifically coded for acute appendicitis with perforation. Precision is important in coding, so selecting the code that accurately reflects the severity and complications is crucial. Question 6. A patient presents with a headache. After examination, the physician diagnoses tension headache. What is the correct code? A. R51. B. G44.209. C. G43.909. D. G44.1. Answer, B. G44.209. This question asks for the code for a tension headache. Starting in the index, look for headache, tension. This directs you to category G44. The tabular list shows G44.2 as tension type headache. The code G44.20 requires further specificity, and G44.209 is for unspecified tension type headache, not intractable. A common symptom like headache requires looking for the specific type diagnosed by the provider. Question 7. A patient is admitted due to an adverse effect of a drug taken as prescribed for a medical condition. How should this be coded? A. Code the adverse effect first, followed by the drug code from T36 T50. B. Code the medical condition first, followed by the adverse effect and drug code. C. Code the drug code from T36 T50 first, followed by the adverse effect. D. Code only the adverse effect. Answer, A. Code the adverse effect first, followed by the drug code from T36 T50. This question tests the sequencing guidelines for adverse effects of correctly administered drugs. When a patient experiences an adverse effect from a medication properly taken, the adverse effect is coded first. The specific drug is then identified using a code from categories T36 T50, which describe poisoning, adverse effects, and underdosing of drugs, medicaments, and biological substances. This sequencing highlights the adverse effect as the reason for the encounter. Remember, an adverse effect is an unexpected reaction when the drug was taken as prescribed. Question 8. A patient has a history of myocardial infarction, MI. The patient is currently stable with no symptoms of MI. How should this history be coded? A. Code the active myocardial infarction. B. Code a sign or symptom related to the history of MI. C. Code a Z code indicating a personal history of myocardial infarction. D. Do not code the history of MI if the patient is stable. Answer, C. Code AZ code indicating a personal history of myocardial infarction. This question addresses the coding of a patient's past medical history when they are no longer receiving treatment for the condition and are stable. A documented history of a condition like a myocardial infarction, even if stable, is often relevant to a patient's current care and should be coded using a personal history Z code. The Z code indicates that the patient has had the condition in the past but does not currently have it. Always look for documentation of a past history that may influence present treatment. Question 9. A patient presents with acute on chronic systolic heart failure. Which code should be sequenced first? A. I50.20, unspecified systolic, congestive, heart failure. B. I50.21, acute systolic, congestive, heart failure. C. I50.22, chronic systolic, congestive, heart failure. D. I50.23, acute on chronic systolic, congestive, heart failure. Answer: D. I50.23, acute on chronic systolic, congestive, heart failure. This question tests the coding of heart failure when described as acute on chronic. When heart failure is documented as both acute and chronic, ICD-10-CM provides specific combination codes that capture both aspects. The keyword phrase acute on chronic directs you to the code that combines these two states. I50.23 is the specific code for acute on chronic systolic, congestive, heart failure. Using the combination code accurately reflects the patient's current heart failure status. Question 10. A patient is seen for a follow-up visit after surgery to remove a malignant neoplasm of the colon. The neoplasm was completely removed, and there is no residual malignancy. What is the appropriate coding for this encounter? A. Code the malignant neoplasm of the colon. B. Code AZ code for encounter for follow-up examination after completed treatment for malignant neoplasm. C. Code AZ code for personal history of malignant neoplasm of colon. D. Code a code for routine postoperative follow-up. Answer: C. Code AZ code for personal history of malignant neoplasm of colon. This question focuses on coding for a follow-up encounter after successful treatment of a malignant neoplasm with no remaining malignancy. Once the malignant neoplasm has been completely removed and there is no further treatment directed at the malignancy, the appropriate code is AZ code indicating a personal history of the malignant neoplasm. This signifies the patient's past condition and the absence of current malignancy. Always check the documentation to determine if the malignancy is still active or if the patient is in remission or has a history of the condition. Question 11. A patient is diagnosed with essential hypertension. What is the correct code? A. I10. B. I11.0. C. I12.0. D. I13.0. Answer: A. I10. This question asks for the code for essential hypertension, which is also known as primary hypertension. Looking up hypertension, essential, in the index leads directly to code I10. This code is used for elevated blood pressure without a known secondary cause. Essential hypertension is a common diagnosis, and I10 is its specific code in ICD-10-CM. Question 12. A patient presents with chest pain. After evaluation, the physician documents atypical chest pain. What is the correct code? A. R07.1. B. R07.2. C. R07.3. D. R07.4. Answer: D. R07.4. This question requires coding a symptom, specifically atypical chest pain. When a definitive diagnosis for the chest pain is not made, the symptom itself is coded. Looking up pain, chest, atypical in the index directs you to R07.4. This code is used for chest pain that doesn't fit the typical pattern of angina or other specific conditions. Coding symptoms is appropriate when a definitive diagnosis has not been established by the provider. Question 13. A patient has a foreign body sensation in the right eye. The provider documents foreign body sensation, right eye. What is the correct code? A. H57.10. B. H57.11. C. H57.12. D. T15.01XA. Answer, B. H57.11. This question asks for the code for a foreign body sensation in a specific eye. The symptom is foreign body sensation, and the location is the right eye. Looking up foreign body sensation, I in the index directs you to H57.1. In the tabular list, H57.1 requires laterality. H57.11 is the code for foreign body sensation, right eye. Coding laterality accurately is important for many ophthalmology codes. Note that this is a symptom code, not an external cause code for an actual foreign body. Question 14. A patient presents with shortness of breath. The provider documents dyspnea. What is the correct code? A. R06.00. B. R06.02. C. R06.03. D. J80. Answer, B. R06.02. This question asks for the code for the symptom shortness of breath, also known as dyspnea. Looking up shortness of breath or dyspnea in the index leads to R06.0. The tabular list provides more specific options under R06.0. R06.02 is the code for shortness of breath. Coding symptoms like dyspnea is necessary when a definitive cause has not been determined. Question 15. A patient is diagnosed with probable viral pneumonia. How should this be coded? A. Code viral pneumonia as if it were confirmed. B. Code symptoms only, such as cough and fever. C. Code pneumonia, unspecified organism. D. Query the physician for a definitive diagnosis. Answer, C. Code pneumonia, unspecified organism. This question addresses coding when the diagnosis includes terms like probable, suspected, or likely. In the inpatient setting, if the diagnosis is documented as probable, suspected, likely, etc., for a condition that is still being investigated, you should code the condition as if it exists. However, for outpatient coding, you would generally code the signs and symptoms unless otherwise specified. The term probable viral pneumonia suggests the physician believes it's viral but hasn't definitively confirmed it. In this scenario, it's best to code pneumonia with an unspecified organism, representing the likely condition without overstating certainty, or depending on the specific setting and guidelines, code symptoms. However, given the options, coding unspecified pneumonia is the most appropriate approach for a probable diagnosis when the organism isn't confirmed. A general rule is to code to the highest level of certainty documented. Question 16. A patient is diagnosed with uncontrolled type 2 diabetes mellitus. What is the correct code? A. E11.9. B. E11.65. C. E11.00. D. E11.9 with an additional code for poor control. Answer, A. E11.9. This question asks for the code for uncontrolled type 2 diabetes. In ICD-10-CM, uncontrolled or poorly controlled diabetes without complications is still coded as type 2 diabetes mellitus without complications. The term uncontrolled does not have a specific code and is simply a descriptor of the state of the diabetes. E11.9 is the code for type 2 diabetes mellitus without complications. Do not look for a separate code for uncontrolled unless it's linked to a specific complication code that indicates control status. Question 17. A patient presents with a painful swollen joint in the left hand, diagnosed as gout. What is the appropriate code? A. M10.00. B. M10.03. C. M10.04. D. M10.052. Answer: D. M10.052. This question requires coding gout affecting a specific joint with laterality. The diagnosis is gout, affecting a painful swollen joint in the left hand. Looking up gout, acute in the index leads to M10.0-. The tabular list requires specificity for the site. M10.05 is gout, idiopathic, hand. The fifth character indicates laterality, with 2 for left hand. Thus, M10.052 is the code for idiopathic gout of the left hand. Accurate site and laterality coding are essential in musculoskeletal conditions. Question 18. A patient is brought to the emergency department after a motor vehicle accident. The patient has multiple injuries, including a fractured femur and a concussion. Which condition is typically sequenced first as the principal diagnosis? A. The condition requiring the most resources for treatment. B. The most severe injury. C. The fractured femur. D. The concussion. Answer: A. The condition requiring the most resources for treatment. This question tests the principal diagnosis selection rule for multiple injuries resulting from a trauma. In cases of multiple injuries from a single traumatic event, the injury that requires the most resources for treatment is typically designated as the principal diagnosis. While the severity of injuries is considered, the focus for principal diagnosis selection in this scenario is often on the injury necessitating the majority of the care provided during the encounter. Always review the documentation thoroughly to determine which injury was the primary reason for admission and treatment. Question 19. A patient is diagnosed with iron deficiency anemia due to chronic blood loss from a duodenal ulcer. Which code should be sequenced first? A. D50.0, iron deficiency anemia due to chronic blood loss. B. K26.4, chronic or unspecified duodenal ulcer with hemorrhage. C. D50.9, iron deficiency anemia, unspecified. D. K26.9, duodenal ulcer, unspecified as acute or chronic, without hemorrhage. Answer: A. D50.0, iron deficiency anemia due to chronic blood loss. This question tests the sequencing of codes when anemia is due to chronic blood loss from another condition. The instructional note under category D50, iron deficiency anemia, states to code first the underlying condition if it is documented. However, the specific code D50.0 is for iron deficiency anemia due to chronic blood loss, which inherently captures the relationship. In cases where the anemia is the primary focus of treatment, it may be sequenced first, followed by the code for the condition causing the bleeding, especially if the anemia is the reason for the encounter. Referencing the alphabetic index entry for anemia, iron deficiency, due to chronic blood loss guides you to D50.0. Follow the index and tabular list instructions carefully for conditions with due to relationships. Question 20. A patient presents with a burn to the right hand, 2nd degree. What is the correct code? A. T23.201A. B. T23.291A. C. T23.301A. D. T23.391A. Answer: A. T23.201A. This question requires coding a burn by site and degree. The diagnosis is a burn to the right hand, second degree. Looking up burn, hand, right, second degree in the index leads to T23.2-. The tabular list provides T23.20 for second degree burn of unspecified right hand and T23.29 for multiple sites of right hand. Assuming the burn is to an unspecified part of the right hand, T23.201 is the correct code for second degree burn of unspecified right hand. The seventh character is added for the initial encounter for a burn. Precise site and degree coding are critical for burn codes. Question 21. A patient is diagnosed with sepsis due to a urinary tract infection, UTI. Which condition is typically sequenced first? A. The UTI. B. The sepsis. C. It depends on the documentation. D. Code a combination code if available. Answer: B. The sepsis. This question tests the sequencing guideline for sepsis originating from an infection. When a patient has sepsis due to a localized infection, the code for the sepsis is typically sequenced first, followed by the code for the underlying localized infection. Sepsis is a severe, systemic response to infection and is usually the more serious condition requiring intensive treatment. Code A41 for sepsis is typically the principal diagnosis, followed by the code for the specific infection site, such as N39.0 for urinary tract infection. Always prioritize the sepsis code when it is the primary reason for the encounter. Question 22. A patient is diagnosed with chronic obstructive pulmonary disease, COPD, with acute exacerbation. What is the correct code? A. J44.0. B. J44.1. C. J44.9. D. J43.9. Answer: B. J44.1. This question asks for the code for COPD with an acute exacerbation. ICD-10-CM has specific codes for COPD with and without acute exacerbation. The phrase "with acute exacerbation" is a key indicator. Looking up disease, lung, obstructive, chronic, with acute exacerbation in the index leads to J44.1. This code specifically captures both the chronic nature of the COPD and the current acute worsening of symptoms. Using the specific code for COPD with acute exacerbation provides a more complete picture of the patient's current respiratory status. Question 23. A patient presents with difficulty swallowing. The provider documents dysphagia. What is the correct code? A. R13.0. B. R13.1. C. R13.10. D. R13.19. Answer: B. R13.1. This question asks for the code for the symptom of difficulty swallowing, known as dysphagia. Looking up difficulty, swallowing, or dysphagia in the index leads to R13.1. The tabular list confirms R13.1 is the correct code for dysphagia. When a definitive cause for the dysphagia is not determined or documented, coding the symptom is appropriate. Question 24. A patient is diagnosed with streptococcal sore throat. What is the correct code? A. J02.0. B. J02.8. C. J02.9. D. B95.5. Answer: A. J02.0. This question requires coding a sore throat caused by a specific organism, Streptococcus. The diagnostic statement includes both the location, sore throat, and the causative organism, streptococcal. Looking up sore throat, streptococcal or pharyngitis, streptococcal in the index leads to J02.0. This code specifically identifies pharyngitis caused by streptococcus. When an infection is linked to a specific organism, always try to find a code that reflects both the infection site and the organism. Question 25. A patient is seen for a routine annual physical examination with no abnormal findings. What is the correct code? A. Z00.00. B. Z00.01. C. Z01.411. D. Z01.419. Answer: A. Z00.00. This question asks for the code for a routine general medical examination without any abnormal findings. Z codes are used for encounters for reasons other than sickness or injury, such as routine exams. Looking up examination, general medical in the index leads to Z00.0-. Z00.00 is the code for encounter for general examination without abnormal findings. This code is used when the patient receives a preventive health checkup and no health problems are identified.